what I was saying, that understanding these prabhavas was not only giving you indication where to use it, but also it is giving you where not to use it. You have to understand both ways. Like I had a patient, she had constipation, most serious constipation I have seen in my life. She was having bowel movement once a month. After taking very serious kind of Virechana herb like Cascara sagrata or very harsh kind of herbs to move the bowel. So she came to me. I had a choice of giving this Vedana herb. I have kutki, I have herbs. Kutki, the formulation with kutki, I have a drops, I have a tablet. I use this kutki as a main ingredient in my liver formula. And if you are experienced, if I have recommended you guys the liver formula, I start sometime with the quarter tablet. Why? Because it has kutki in it. It has the Spicarosa curava in it. What it can do? If somebody has this kind of chronic constipation going once a month, of course, the pindas the malas are there, stuck in the intestinal wall, and if I will give kutki to that patient, it will start doing its job. It will start disintegrating the pindas, but what kind of side effect it can do? It can scrape the intestinal wall and create hemorrhage there. Because these malas are not sitting alone there. There's some amavisha sitting there, and some hidden inflammation is already there because of these acidic toxins. And if I will give this kutki, it will do its job, it will do its action, it will do its prabhav, it will just scrape, try to pull out and break things, and then the result may be ulcerative colitis. And believe me, I have seen these victims of wrong prescription. That's why you have to do your homework before practicing Ayurveda, before using herb. Get all the details. I have seen like people are, you have constipation, don't worry, take half teaspoon of kutki twice a day, or 1 teaspoon of kutki powder twice a day. Of course it starts working, it activates liver, it activates colon, and it does his Vedana work. And then what happens? Either IBS is the simple gift they get. The most simple, most easy gift they get IBS, but they cannot connect why their bowel is always irritable. And they say, that was Ayurvedic herb, how it can harm? Ayurvedic herb never harm, but wrong prescription of anything can harm. That's why we are learning this deeper understanding of prabhavas of all the other herbs. Then you have this Rechan. The Rechan is the word for Virechan. See, there is Rechan and Virechan. Why there are two words? Rechan is, you can say Rechan is purgative. Not laxative, purgative, with purges, which is purging. Laxative you can say like a psyllium seed, and which makes like little smoother. Rechan means purgative. It's really pulls out the toxins, pulls out the bowel movement. It little bit forces the bowel area. This is Rechan. Virechan means a specific Rechan. When you say Rechan means general, means it's a purgative, it helps to clean colon, by putting a little bit of force there. And virachan means when we're making a specific choice for that individual person who may have the very specific kind of imbalance in the colon, related to liver, related to stress, related to so many things. But rachan is, in general, purgative. What says, vipabaddham yadapakvam va maladi dravatam naet recham matyapi tajmevam rechanam triyuta yatha. Vipabaddham yadapakvam. Vipabaddham means if something is clogged in the colon, either it is pakvam or apakvam, vipabaddham, just clogged, ripe or unripe, cooked or uncooked. Va maladi dravatam nait. What happens? All the pakwas and apakwa, cooked and uncooked, what it does? It melts them down, make them kind of liquid. It melts them down, making liquid. Rech matyapi tajmevam. Rech matyapi means they flush them out. Flush them out. Tajmevam rechanam triyuta yatha. That is called rechana, and for example is called triyuta. Triyuta is, yesterday I was trying to tell you, triyuta is, what's that? Yeah, nishot. Tribrit. Tribrit is the Sanskrit name, other Sanskrit name of triyuta. Nishot is the common name. And Tarpeth, if you have heard, the Tarpeth is the English name of Nishot. What it does, it is a perfect rachan. I use them little bit in my acid care formula. Rachan to help to get rid of any unwanted, unused pitta sitting in the colon. So rachan means either cooked or uncooked malaj, whatever is sitting in the colon, it melts them down and flushes them out. See the mode of action here? When you have before the sansran, if you have you have now, first we had a sansran, you need the sansran also to cook little bit something. When suppose you're making a virachana, if you're making a specific rachana, a specific purgative for somebody, you will like to mix these things, make it together, something to warm up, melt them down, okay, and then you have, if it is necessary, somewhere sitting some very clogged hard ball kind of, so you can use little some Vedan drabyaj also, and then you use Rechan drabyaj also, so that flush them out. That's how the whole prescription works. You might have seen me with that, like I say, okay, do this Prakrit tablet, 1 in the morning, Triphala tablet, 2 at night, and also do the Prakrit cream, and also do acid formula, and also do the liver formula. I am using all these. Liver formula has kutki. Liver formula has some Vedan drabyas, but I am very careful. I am saying, oh no, I am giving in a drop form. What I am doing in these drops, I am capturing the prabhava, just the prabhava. See, kutki has its own rasa, kutki has its own guna, kutki has virya, kutki has own vipaka.